This is Dentistry Disrupted with Dr. Craig D. Clayton. I'm a wellness and biomimetic dentist, passionate change maker, social media thought leader, and educator on disrupting the way we approach oral health care. Come along with me as we journey towards a healthier and more empowered you. Welcome to another episode of Dentistry Disrupted, and today we are diving into the difference between functional medicine and traditional medicine, and how functional medicine providers and functional dentists can work together to better serve their patients. Joining us on the podcast today is my friend Lyndsy Kinghorn, the owner of Foundation Functional Medicine in Boise, Idaho. Lindsay is a dual board certified family and anti-aging nurse practitioner with a passion for helping people heal from the inside out. Lindsay specializes in gut health, hormone balancing, autoimmunity, sustainable weight loss, and more. She is my personal functional medicine provider, even though I've been negligent, and has helped my family immensely. When she's not in the clinic, you'll probably find her mountain biking, rock climbing, hiking, or exploring new places with Rob and their dogs. Today, we're diving into the differences between functional and traditional medicine, functional and traditional dentistry, and how these two professions can collaborate on care to improve patient outcomes. So welcome to the show, Lindsay.
Thank you. Thank you for having me.
To start off, can you share your journey into functional medicine and what inspired you to take this path?
Yeah, absolutely. I feel like a lot of people who are in the functional space found functional medicine through their own journey, health journey. I, as you stated, am a nurse practitioner. My previous career was in emergency medicine. I did that for many more years than I'd like to admit. I was also a competitive CrossFit athlete, so working shift work, working out, I say 8 days a week, but at least 6 days a week, pretty hard competitively. And I just found myself with these new symptoms that I hadn't experienced before. New gut symptoms, hormonal imbalance, behavioral things, libido was in the tank, and I went to my allopathic colleagues and said, I'm having all these symptoms. And there wasn't much of an answer. Basic blood work, antidepressant, work out more, eat less. I don't know what to tell you. And so I just
work out more.
Yeah, right. Work out more, eat less. Not the answer.
And I'm sure you were eating really well. You were competitive.
Yeah, I was eating definitely well. Probably not enough looking back, but for sure not the answer I was looking for.
Yeah, and that had to be really frustrating, especially with everything you know.
Absolutely.
As a nurse in the emergency medicine space, I'm sure you were very well versed in so many specific things.
Absolutely. So that made me reach out or look for other alternative care. I actually kind of thought functional medicine was woo-woo coming from the emergency department. I'm seeing a lot of the bad care in the ER, and my first visit with a functional medicine nurse practitioner changed everything for me. I realized this is how I wanted to treat myself. This is how I wanted to treat patients. And I say I drank the Kool-Aid that day.
Okay.
I jumped both feet in.
Well, for our listeners, can you define what functional medicine is and how it differs from traditional medicine?
Yeah, so functional medicine people really say is root cause medicine. I'll describe that a little bit more, but that's really the difference from traditional or allopathic medicine where it's more symptom-based management. In functional medicine, I like to use the analogy of, let's say you come to your doctor complaining of migraines, and your allopathic or conventional medicine doctor says, well, here's a prescription for an abortive medication. Maybe take some Tylenol the days you're not experiencing a severe migraine. In the functional space, I want to know the why. So I'm going to look deeper. I'm going to say, maybe this is a food allergy. Maybe this is hormonally related. What are your exposures? How do we figure out what's causing the migraines? Fix the root cause as opposed to just symptom management. Yes,
which is so often missed in medicine. It's really discouraging how normal it is to just medicate every symptom. And also, I've learned, and correct me if I'm wrong, that a lot of the normal range of values for labs are very high and can be inaccurate as to where we actually want our levels to be as far as nutrients and hormones and other things in the body.
Absolutely. I always say we look under a different lens in the functional space. As we know in conventional medicine, the lab value ranges are based on general population, and unfortunately we know that population is sick. So we're looking at more optimal ranges, which do make those lab ranges more narrow to really optimize health, prevention, longevity.
And I first met Lindsay, I think 2 years ago. I don't know, did our paths cross, I think on Instagram? just via some messaging. We've met some amazing people on Instagram, and Instagram is one of my first exposures to a more functional approach in dentistry and then in functional medicine. So Lindsay and I connected, started talking. I had some questions because I was seeing patients where things weren't adding up. They had oral diseases. They were doing all the right things, but they just didn't have the answers from other traditional dental models. And they asked me the questions like, oh, I don't know. So I'd send Lindsay some text messages, and then I started working with Lindsay on my own health. And I have to admit that I have not been the most consistent, as so many things have been very much needing attention in my life, but working to get back on the bandwagon here, especially approaching summer and bikepacking season. The story that I love the most, though, is the success that Lindsay has had working with my wife, Eliza, because she has been struggling with symptoms that were dismissed repeatedly, and these symptoms have been ongoing for years, and she's been very frustrated because she hasn't had answers. She had lab tests done. You know, they said everything's normal, everything's ideal, no problems, basically go on your way. And then she met with Lindsay and did some lab tests, and, well, you can tell me they were pretty different than, they were not normal.
Absolutely.
They were not within the normal ranges.
Yeah, I think, most of the time it's just looking deeper. We want to take a deeper look into people's health. In the allopathic model, they get very minimal testing, and everything is quote-unquote normal, right? As we know, I said before that normal is not optimal. We look at things via a different range, but we could uncover a lot of other concerns if we take a deeper dive.
Yeah, and for Eliza, there were some pretty serious things that were identified that, if continually overlooked, would have caused significant issues down the road. And these things just wouldn't have been caught in a conventional model until things became more serious. So I'm really grateful to you for working with her and helping her figure out those things so she can optimize her health. And she's much more compliant than me. She's more on top of things. But it's I knew that you working with her would help to change our family and lifestyle. Sure. And so that was definitely the right choice. And we've made a lot of changes, and it feels good to be on a much better path. And there's still so much to learn, but I feel like it's really important that everybody work with a functional provider that can optimize their health, because as you said earlier, so many of us are, in general in the population, are sick.
Yes. And even more than, the cool, I always talk about this, the cool functional testing that we can offer, which is amazing. I just feel patients want to be heard, and we can glean so much information from the intake of just listening to the patient. Can't blame our allopathic colleagues. They get 10, 15 minutes with the patient. When I get to spend 90 minutes with a new patient, and we can really dive into and uncover things that could have been missed very easily without having the time to do so.
That's amazing. That's really how it needs to be, to get to the bottom of things and help people heal and get better. And I've heard so many great stories through podcasts and books. I'd love to hear about some of the transformations you've seen in your patients that really stand out to you, and how having a functional whole body approach impacted their health. So are there a couple stories that you could highlight?
Yeah, if you know me well, I love gut health. It is like my favorite thing to help people with. And so I like to share about gut health stories. I get so many, this is just like a day in, day out thing for me. I get so many people in the office who are in their mid-20s and 30s and have had 4, 5, 6 colonoscopies. They've been to every specialist for their symptoms, and nothing has been done about it. Again, that Band-Aid approach of, here's some Imodium. Imodium will help with diarrhea if you're having diarrhea, or, take some Miralax for your constipation.
Gosh. And those are young. Those are young patients, 20s and 30s.
Absolutely. And they've just been overlooked. And colonoscopies are obviously wonderful. Screening exams are wonderful, but there are risks as well. And so if we're using them in these younger patients, it can be risky. But we take a deeper approach. I obviously listen to the patient. A huge needle mover in so much of my patients' lives is talking to them about how they eat their food, not necessarily what they're eating, but how they're eating it. I actually have a free eating hygiene on this. They can go over to my Instagram and find that. But the other aspect that we find a lot is we look. So I do comprehensive stool testing, breath testing, and stool testing. And I have literally mitigated these symptoms that patients have been dealing with for 10, 15, maybe even 20 years because I listened and I looked, and we can reverse that. It's not something they have to live with the rest of their lives.
That is amazing. Will you flesh out a little bit more? What are some some of the most frequent symptoms that patients will experience if they have a gut issue?
I think people think gut symptoms are normal, but most of the time, constipation, maybe going to the bathroom once or twice a week, diarrhea. I work with a lot of people who can't be, away from a bathroom for any certain amount of time because they're not sure when they're going to have diarrhea. Bloating, food sensitivities. I see this with skin rashes. Pretty much anything you're experiencing is probably related to your gut.
Interesting. Okay.
Yes.
Why is that?
The gut.
Why is the gut so key in our overall health?
Yeah, I mean, it's our absorption, for one, right? It's where we get our nutrients from. A big part of our immune system is housed in the gut. So we think about immunity, autoimmunity, lack of absorption. It is a huge detox pathway, thinking about detoxifying from things we're exposed to, but also hormonal health. So it really affects everything.
Interesting. I see a lot of patients that are in their 20s and 30s. That's my main demographic as well. And I've been startled how many patients report autoimmune.
Yeah.
Autoimmune diseases or symptoms of autoimmune diseases, especially hypothyroidism and Hashimoto's. Is that gut related, or are you seeing that as well? What are your ideas as to why that's occurring? It seems so prevalent.
Yeah, I see. I mean, that's honestly something I specialize in is Hashimoto's, so I see a lot of it. I actually think there's even more that's just not uncovered because people aren't testing. Oftentimes in the allopathic space, nobody tests antibodies until your thyroid studies are off, and that's not the time, right? 'Cause a lot of damage has been done already. When I'm seeing anybody with autoimmunity, but specifically Hashimoto's, I definitely start with optimizing the gut because of the immune system reaction. Of course, I'll remove foods that they could react to. I utilize some supplements and nutraceuticals. I think part of it is our exposures that we don't have really control over. Okay. Stress is a huge portion of that as well.
Okay. What are some exposures?
So I see a lot of times onset of a autoimmune can come from some sort of an infection, getting like gastroenteritis, a chronic viral, or listen, the pandemic that happened can set things off. For sure, traumatic events can be a big part of it.
That is so interesting. So interesting. Well, I would like to ask you as well, because you do specialize in hormones. What are some common symptoms that you see that indicate, okay, there may be a hormone issue here that has been overlooked at large? What are some things you're looking for as well?
In younger patients, just the irregularity of their cycles, very heavy bleeding or lack of periods. Infertility is big, unfortunately. I see a lot of fertility patients. As we age, definitely looking at vasomotor symptoms, so hot flashes, night sweats, difficulty with sleep, stamina, body composition changes would all lead me to think some hormonal changes. When I think about hormones, I think about more than just reproductive hormones, which people get hung up on, but it also includes thyroid, insulin, and cortisol, so we get that full picture. Okay.
And are these are hormone issues as well tied to the gut?
They are.
Okay. All right. Yeah. Everything, all roads lead back to the gut.
Yes.
Okay. I love that. Well, functional medicine has been so eye-opening for me, and it was one of the things that helped me discover a more functional approach to dentistry. As I shared earlier, when I opened my practice, I went to a CE course, and it was the first time I had heard preached that cavities are caused by a curable disease. And so that got me thinking, and there were a lot of other things in this CE course. It was 5 days, like 50 hours. It was a lot of information, and that was a recurrent theme of there are solutions to these underlying problems. And so even though the CE course was a bit more conventional in some ways, really opened up my eyes and came back and thought, oh, wow, we actually have solutions for these things. And, I was not too far out of dental school, so everything was really fresh on the mind. I thought, wow, I didn't learn about dentistry in this way, whether it comes to worn teeth, jaw pain, oral disease, cavities. And then I started having patients come in, one mother in particular that came in and brought in a child that had an abscess tooth that I had to remove, and was just very emotional, saying, my other kids don't have issues, this kid does. What's going on? We do this, we do that. We don't use fluoride. And I thought, well, there's no way fluoride is the linchpin here. And so I know I turned to Lindsay for some answers, and then started digging into things myself, and just uncovered the reality that there are so many There's so many risk factors that have to be identified. And a big one that leads me to referring patients over to you, Lindsay, are nutrients, nutrients and hormones, because we know that affects the saliva composition, the saliva flow in the mouth, which then impacts the oral microbiome, increases risk of caries or gum inflammation, and then that bacteria is getting into the bloodstream through the inflamed gums, and then we're swallowing that bacteria, and then that affects things downstream into the gut. And so it has been really interesting to learn how overlooked the oral environment is and how important it is that patients, as they're trying to heal their mouths, if functional medicine isn't on the mind, then it needs to be, because it's an essential component in a big thing people care about is not getting cavities anymore. Patients need to work with providers like you to be able to achieve that goal. A couple of common oral health issues that I see that might indicate that there are some bigger things going on with overall health. A big one is oral inflammation. So when I see chronic inflammation of the gums, one screening question that I'll ask is, have you had your estrogen levels checked? Because estrogen dominance is associated with low salivary flow and also a very reactive immune system as far as in the gingiva. So something that we'll see is that these patients will tend to have more inflamed gingiva, more gums. The gums will bleed more easily. And it's interesting because I've asked some patients that have had testing, like, oh, yeah, I have been diagnosed with estrogen dominance. That's interesting you ask. And so that's been really fun to learn and be able to screen for those questions. And then another thing, breathing, because then breathing affects sleep. And you are a big advocate of good quality sleep as a key ingredient.
Yes.
Why are you laughing? You should tell them.
Oh, why I'm laughing is because this is something, especially opening up a new business, growing, working in the education space as well as a clinician, and then having 2 little boys can lead to some low sleep nights, which then makes it so much more difficult to optimize health. And then my wife, Eliza, on her journey here, she doesn't sleep well, no matter how much, what amount of time she's sleeping, per se, or in bed, even 8, 9, 10 hours, she just still doesn't feel rested. And that's a problem, isn't it?
Working on it, though, right?
We're working on it.
Yeah.
It's a journey. And so there is that connection in that way. The oral environment, air comes in, should be coming in through the nose and not through the mouth. So not a good thing. How do you feel it has improved patient care to collaborate together in taking care of patients?
Yeah, I think collaboration is huge. In the office itself, I take a full team approach to health. I have a team of experts that work with me in a way to really help patients move the needle. I know that as a solo practitioner, I can help patients, but having other experts in my back pocket is how people get better faster. And similar with working with you, that is where you hone. That is your specialty, and I can always trust that when I send somebody to, they're going to get top care and referral back and forth. So I love collaboration for that whole body health.
Yeah, I love it too, and I feel a bit of jealousy, to be honest, in your model, because you are a couple steps ahead, and I really look forward to the day when I can bring in some other oral health specialties into my office to be able to do the same. So when I see airway issues, we have in office people that can help with those issues, so that when patients come to me, I have the team that I need to be able to support them in their oral health journey.
Yeah, absolutely.
So I hope I can get there sooner than later so I can improve patient care even more, especially with consistency, because it can be hard for people to see 3, 4, 5 different providers. I love that you're able to keep the services of collaborative care under the umbrella of Foundation Functional Medicine. Anesthetics, it just makes it so much more seamless for patients.
It's definitely easier for them, for sure.
Yeah, it's a wonderful model.
Yeah, thank you.
So for people listening, what's one simple mindset shift someone can make to reprioritize their overall health?
Don't make it too complicated, I think is my biggest take-home piece. I literally name my practice Foundation, because that is the biggest needle movers for people, is fixing those small things that don't seem big. I can order amazing comprehensive functional testing on patients, but if they're not sleeping, eating, a whole food diet, their relationships are crap, and their stress is high. None of that stuff really matters. So just focus on the simple things that you can change, and it'll make a huge impact on your overall health.
And that, I'm glad I asked you that question, because that reminds me of what I really love most about Lindsay and Foundation Functional Medicine is her custom tailored care. I see a lot of patients, and a lot of my patients work with functional medicine providers, or we get them to functional medicine providers. I have seen that with some providers, it's still a pretty blanket approach where it's like, okay, cut these things out, start doing this, stop doing this. And it's pretty generalized, which can be difficult, especially when these things require a lot of changes. Like immediately cut out all these foods, do all of this, don't do all of this. These are pretty extreme. And when I started working with you, those 90 minutes of you listening to my health history and pre-existing things that I've been working through, and how you custom tailored changes to me that felt within reach. And that was really important, because I was nervous about that going in, especially with, and I'm pretty transparent with my audience, but especially with a history of disordered eating. Mm-hmm. I was pretty nervous going in that I was going to be recommended some pretty, not radical, but a lot of changes in my dietary habits, and I was worried about slipping back into that disordered eating pattern. So that is something that I love. I get a little emotional about it, but that's something that's so important to me, because it can be a little unnerving maybe to enter this space. Maybe there's some unknown, or people hear some stories, or there's so much to do. And so that is something that, I'm grateful that you do for patients, is truly meeting them where they're at.
Absolutely. It should be individualized.
I love that. Do you have any resources or some things that you could tell a member of our audience to look for in their search for a functional medicine provider in their area? Because we do have listeners from all over the world. What are maybe a couple things that you would look for, or one or two screening questions? Yeah,
great questions. Just in general, people who have done continuing education, I think functional medicine is kind of a buzzword. You probably feel that in dentistry maybe as well. Yeah. And so there is the Institute for Functional Medicine. I am actually board certified through the American Academy of Anti-Aging. You can go to their websites and you can search providers locally. When you're interviewing or talking with the staff or even the provider themselves, I always say ask about their, continuing education, some patient outcomes they've seen with other patients. The credentials are great, but not always indicative of a great provider. I want to empower patients to know or to realize that they have the choice, and so they should ask those questions and make sure they're a good fit for them.
That's great. That's great feedback. Mm-hmm. And for those of you who live in the Treasure Valley here in Idaho, Lindsay is an incredible functional medicine provider, as I think we've hammered home pretty well. And she offers support for your gut health, hormone health, weight loss, and more. And we have seen incredible results by collaborating on patient care. So if you live here in the Treasure Valley, in Idaho, or even live in Idaho, she can also do virtual care. Please schedule an appointment with her. She is amazing. But she also offers virtual services in several other states. So some of our listeners will have the opportunity to work with her. So which states are you licensed in?
Yeah, thank you for asking. We offer virtual services in Alabama, Arizona, Colorado, Idaho, Montana, South Dakota, and Washington at this time. More to come.
All right. Yeah. That is exciting. That is amazing. And do you have any resources that you could share to help someone get started on their functional medicine journey?
Yeah, again, start simple. On our Instagram, I do have a free dietary hygiene or eating hygiene guide. Simple way to fix the way you eat your food and the way your body digests food. You'll have much improvement of your gut health just by changing those things. And then I offer a gut healing protocol as well. All can be found on the website or on Instagram.
That's so great. And we'll make it really easy for you, listeners. We will link those resources in the show notes so you can get those real easily. And again, if you are local to the Treasure Valley, please set up an appointment, start your health journey, get better, feel better, and you'll be so happy. You'll be so happy working with Lindsay and her team because they're They're just wonderful humans. Wonderful people.
If you would like to work with myself and my team, there's a couple ways to do so. You can go to our website, foundationfunctionalmedicine.com. You can schedule a discovery call or an appointment right from our website. You can also follow us on Instagram and schedule both an appointment or a discovery call from there as well.
Okay, awesome. Thank you.
Thank you.
And we will link her website in the show notes as well. So, again, make it real easy for you to schedule that appointment. Thank you so much for joining me today, Lindsay.
Thank you for having me.
It's always fun to chat.
Absolutely.
And thank you to our listeners for joining us on this episode of Dentistry Disrupted. Until next time, see you later.